Minutes and half a day, the Committee on the Environment, Revenue, and Taxation Procurement is calling this virtual public hearing to order. The time is now 9:07 a.m. on Friday, November 6, 2020. A notice of this morning's virtual hearing is provided via email to senators, stakeholders, and local media on October 29th, 2020 for the 5-day notice, and November 4th to meet the 48-hour notice, thus meeting the requirements of open government law. I would like to acknowledge the senators that have joined me here today. Senator Therese Terlahi, Senator Kelly Marsh Taitano, Senator Will Castro, Senator James Moylan, and Senator Mary Camacho Torres, excuse me. The purpose of this virtual public hearing is to receive testimony on Bill number 276-35 COR, introduced by the Committee on Rules by the request of Imagahagan Guahan, the Governor of Guam, in accordance with the Organic Act of Guam. It's an act to amend Section 3417 of Article 4, Chapter 3, Title 11 of Guam Code Annotated, relative to limiting the hours of the day within which alcoholic beverages may be sold by off-sale licenses. The second item on the agenda this morning is Bill number 386-35 COR, sponsored by Sabina Perez, myself, and co-sponsored by Senator Therese M. Terlahi. It's an act to amend Section 19102C and H, Section 19104M of Article 1, and Section 19202A3 of Article 2, Section 19403A1 of Article 4, and to add a new Section 19203 to Article 2, all of Chapter 19, Title 10, Guam Code Annotated, relative to clarifying emergency health powers and connecting it to procurement law. The committee will continue to receive written testimony until 4 p.m. on Friday, November 13th. Please address the testimony to myself, Senator Sabina Perez, Chairperson of the Committee on Environment, Revenue, and Taxation and Procurement. It can be dropped off at the mailboxes at the Guam Legislature or emailed to office@senatorperez.org. So to go over the rules of the conduct for the virtual hearing, the host of the hearing will mute all participants until called upon by the chair, and virtual background should not be utilized during this hearing. When called to speak, please ensure to unmute yourself and please state your name for the record. Members of the committee wishing to speak may indicate their desire through the in-app chat feature. The order of questioning being the order of request. Line of questioning will begin with the chair, and then it will be continued with other members. Each member will be allowed to pose questions to the individual agency. Individuals testifying shall be first recognized by the chair before speaking. Questions and testimony shall be confined to the substance and nature of the agenda, and personal inference as to character or motive of any senator or individual testifying is not permitted. Any violations of this general rule of conduct will result in the removal from the public hearing by the host. And now to begin the agenda, Bill number 276-35 COR, introduced by the Committee on Rules at the request of Imagahagan Guahan, the Governor of Guam, in accordance with the Organic Act. It's an act to amend Section 3417 of Article 4, Chapter 3, Title 11 of the Guam Code Annotated, relative to limiting the hours of the day within which alcoholic beverages may be sold by off-sale licenses. So we did reach out to the governor's office to see if they would be willing or be able to provide any testimony and introduce the bill. We will still reach out to them, but we do have Deputy Director Michelle Santis here to provide some testimony on Bill 276. You're recognized, Michelle, if you would like to unmute yourself and state your name for the record again.
My name is Michelle Santos. I'm the Deputy Director at Revenue and Taxation. I would like to provide testimony on Bill 276-35. Good morning, Honorable Senator Perez and other senators present. Thank you for the opportunity to provide testimony on Bill 276-35, an act to amend Section 3417 of Article 4, Chapter 3, Title 11 of the Guam Code Annotated, relative to limiting the hours of the day within which alcohol beverages may be sold by off-sale licensees. This bill seeks to address the issue of public safety, in particular the issue of underage drinking, In 2019, our island saw multiple incidences of riots in our high schools where it was found that students were under the influence of alcohol. In a September 18, 2019 news article, the Pacific Daily News entitled Sarson Robert, 18 charged in Tejan High School riot. One student had participated in a high school riot, stated that he had purchased alcohol from a store. DRT's compliance branch, which regulates ABC laws, was activated to participate in a multi-agency operation with the Guam Police Department to address the issues of alcohol sales to minors as a result of this. The article goes on to state that the issue of alcohol in schools is not a new one and is something that the Guam Department of Education has indicated is a continued challenge. The issue of ABC compliance is important as we work to ensure that licensees are following the law and to ensure that the safety of our community, In light of this, the Department of Revenue and Taxation supports this bill. Thank you very much.
Thank you so much, Deputy Director Michelle. So just to clarify, so Deputy Director is representing the governor's office. Her testimony is
Yes,
representing.
yes.
All right, thank you. So I would like to also recognize Senator Telo-Taitigui, who's joined us here today. So I would like to open the floor to any questions for my colleagues to if there's any questions regarding this bill. Senator Kelly Marsh, Taitano.
Just Maasi, Madam Chair, and I appreciate the proactivity of this bill. Its intent is for very important causes, ones that we've spoken of as a body from time to time, the concern of, well, drinking in general and the effects of it, and certainly amongst the youth. And so I think it's very important to hear the different perspectives and consider how this may help. So with that, it was helpful to hear from Ms. Santos and the situation where there had been at least one incident where they had mentioned that they had purchased the alcohol at the store. And I apologize if I missed it, but are there any statistics known of this access to alcohol in the daytime or the morning time, really, and its impact upon the youth? Are there any studies or statistics or sort of consensus amongst high school counselors or Department of Public Health officials, if there's any more to elaborate on in that regard?
If I may, Senator, I believe mental health would have some of those statistics, and possibly the Guam Police Department. I know that they keep those statistics, especially GPD, because just in dealing with cannabis rules and regulations, I know they keep the statistics on infractions and things like that. So I know possibly those two agencies would have those statistics. We don't keep those statistics. We're strictly enforcement with the business establishment. We go after the business establishment if they are selling to minors. We would pull their license, or the board would punish them in some way.
So just Masi, yes, I'm very interested in looking up those statistics because, I mean, they inform us and they tell us the reality of the landscape, and that's important for us to have a real understanding of. The other would be, we just heard the other day a bill about opening up sales of alcohol. Now this is quite different, but part of what we had done is compare the store situation of being able to sell from 9 a.m. till I think it's 2 a.m. And then what some of the restaurants were asking for and had been put forth in a bill. So this creates further disparity between the two. Are there any thoughts that would like to be shared about, I guess, the difference between selling at a restaurant establishment and selling at a store? I mean, well, I certainly see what I'd like to hear.
Yeah, the store would be an off-sale license. The restaurant would have a combination of an on-sale, off-sale license. My understanding is possibly because of the pandemic, the on-sale, off-sale license would have to be sort of a temporary fix. But I don't know that that's the way it's going to happen. Depends on the legislature, but typically we have one or the other, but not both. There are problems with that bill with minors. If the minor is the one delivering the food, that won't work out. It has to be somebody who's 21. So, it would be a problem for the business owner to hire somebody that's 21 to deliver the alcohol beverages. So it's things like that we have to, fine tune with that bill. But those are some of the things we're looking at with respect to the bill itself with the ABC board and the ABC branch.
Yeah, and if I could, I guess the last consideration would be, we've been hearing amongst our community and reading some of the stories about the toll of this pandemic on people's mental health, including the youth. And so, I would think that that's also something to take into consideration, that there may be more of that situation being exacerbated right now, that, for a variety of reasons.
Yes.
So I guess that would be something I would further like to maybe seek out from the police department and the mental health divisions, and maybe even the schools if
Yes.
Yeah, I know they're in person, so they may not be collecting those statistics right now, but just to hear from them, because if it is really impacting our youth, I think that's something we need to think about very seriously. I mean, that's maybe one of the biggest considerations here. But Sedus Maasi, Madam Chair, for letting me ask these questions. Those are the ones that I had immediately in mind. And I look forward to hearing other perspectives and other questions should they arise.
Thank you so much, Senator Kelly Marsh Taitano. And just for the audience that are listening, so what this bill would do, it would limit off-sale license sale of alcoholic beverages between the hours of 12 a.m. to 2 p.m. of any day, and then on between 2 a.m. and 9 a.m. on Saturdays and Sundays, holidays as listed in per law, or any holidays declared by Imagahaga Guahan. So this is what the bill does. And sorry, a question for you, Michelle. What was the outcome of that, the investigation of the youth that purchased the alcohol?
I believe, I'm not sure, Senator. I believe that we did do an investigation, but I believe it was inconclusive. I'm not sure. I know we didn't pull any licenses, to my understanding, nor was the store cited. I'll double check that, but I don't think anything happened. I think the investigation was done, but it proved to be inconclusive.
Mhm. Yeah, so yeah, having been a teacher myself, I did see the impacts of alcohol use and the addiction to alcohol at such a young age, which is very critical. The brains are still forming, and the effect of drugs at that age is more impactful. So
Yes.
yeah. So I know schools generally let out around 2:45 or 3. I mean, some schools get out earlier. So I just wanted to know what I guess the rationale behind 2 p.m. If students are let out at like say 2:45. I mean, I know the earliest ones probably get out around noon or closer or 1 o'clock or something like that. I forget, but I know the later ones come out at 2:45, closer to 3. So I think what was the rationale for the 2 o'clock?
I guess the kids are not in school. That would be the reason. And to get back to you on the on that incident with the youth buying the alcohol from a store, that the uncle gave the boy the alcohol. He's the one that bought it. So the uncle was arrested for providing the alcohol to the minor. But the store owner didn't get in trouble. To go backtrack a little bit, but as far as the 2 p.m., I believe it's because the kids get out of school around that time, and I don't know what the rationale is there. I mean, they shouldn't be sold the alcohol to begin with, so I believe it's just so that adults can buy it at that time, because I don't know about you guys, but I've seen people buying alcohol as early as 9 o'clock in the morning at like Payless. I see them walking out with the case. So I just can't understand that, because I'm really not a drinker, but 9 o'clock in the morning, really, that's kind of early, but it might be for later on, but they still buy it that early. Adults do. So that would just postpone whatever they're buying till later, much later.
Okay. All right. Thank you, Deputy Director. I see we're getting Director Ariola on, and just like to give her the floor when she comes on to provide her testimony. So we'll give her a little moment. Okay, so there seems to be some sort of glitch. So we'll go ahead and ahead with the questions. Senator Terlahi, do you have any questions at this time?
Yes. I echo questions that were asked earlier by Senator Titan, that the rationale for, on your question also, the rationale for the 2 p.m. How does this curb the underage drinking, if that's the goal? How does the bill? Yeah, what do we have to tie these time periods to underage drinking, especially if we found during investigations that they're not selling to underage drinking, they're selling to uncles who are giving to underage drinkers? And what are the conflicts between this and the bill we just heard that was trying to expand the hours of drinking or sales of off sales, for takeout alcohol or off-premise alcohol? And I guess what I of course I support the intent of the bill, which is if it's to stop underage drinking or to curb underage drinking, or those are all violations of their ABC license. So I would like to know, what is the impediment for the ABC board's enforcement of the licensing rules and regulations? What is their ability to do investigations? I was hoping they would be here too, because really we're relying on them to do investigations of stores. If they are violating, sales to underage persons, then that should be stopped. And if relatives are giving to underage persons, of course, those should be stopped. They should be made very, very public so that the public can take very seriously that we are, trying to enforce these laws, and that they have serious impacts. But I just don't feel like we have heard much about that type of enforcement. So I don't know, Michelle, are you able to talk about that I know the Department of Revenue and Tax has, a direct correlation with the ABC board.
Yes. Unfortunately, the board didn't meet in time for this public hearing. They're meeting next Thursday, so they will discuss this bill. So we didn't get their input. But our ABC branch has 5 to 6 people, and they're in charge of ABC enforcement, and we do other things, including cannabis. We assist with the bonded warehouse. We also assist with business license when we have to pull a license. We assist with other investigations. So they also do administrative work with licensing the establishments and the people that work in the establishments that that handle alcohol, like bartenders and things like that. So we do all that. But when we do get reports of violations, they do an investigation, and they work with GPD on this. And from what I know, they do inform us, if it's serious, and we do provide support, and so does GPD. But the two agencies, agencies, they work together to resolve whatever, and try to right the situation and charge those that are in violation of selling to minors or whatever they may be doing that's wrong.
All right.
Did I answer your question, Senator Turley?
I guess
I'm sorry.
so. I'm hoping that the ABC board will have some concrete recommendations as to how to better enforce, underage, selling to underage. I know that the bill was introduced by the governor together, with a set of bills that were intended to reduce violence that we were seeing. And in this, particular case that you described, it had to do with underage drinking. However, these were all intended to reduce violence. And we all know alcohol and violence, they are connected. However, the times of the sale of alcohol, that's the part I'm just not sure has been well connected for us, at least here. And I would like to see if that type of connection is available so that we can rely on that, when we deliberate on this bill. But
yes.
I know that the Tobacco Coalition, they were very active in trying to enforce sales of tobacco, the prohibition on sales of tobacco to underage minors, so that, and they were increasing, their task force's ability to go into these stores, do undercover, I don't know what they called them, but definitely to investigate more. And so I'm hoping that there is something set up like that for alcohol investigations. And I feel like that would help us, as opposed to limiting the sale for those who are following the law. They're buying alcohol in advance because, they want to use it later in the day or anything. I just, the time just not direct. I don't know. I'd like to see if there's anything that correlates. Thank you, Madam.
Okay. Thank you.
Thank you, Senator Shalahi. Yeah, and I just thank you for those questions. And in my experience as a teacher, students will bring in alcohol early in the morning too, as well. They would be caught with it, and they would have drunk it before even entering school. So I believe there needs to be some measures that would address how they access the alcohol, whether it's by an adult, purchasing it for them, like as in this case. But I did reach out to the ABC board for testimony, so I am looking forward to what their recommendations are as far as ensuring that these are enforced. So we do have now the director from Guam Behavioral Health, Teresa Ariola. Good morning. I would like to offer you the floor if you're ready to provide testimony at this time.
Good morning, Madam Chair, Senators. Thank you. I submitted a written testimony. I'm not sure, Senator Perez, to your office. And so I'm not sure if that's going to be able to be shared, or how do you want me to do this? Or, I mean, you're eventually going to get the senators' copies, I'm sure. And I can just do an oral synopsis of the testimony. How would you like to do this?
I appreciate if you don't mind reading the testimony in its entirety.
Sure, no problem. No problem. Thank you. Just give me a minute. Technology, so interesting.
Yeah, well, I'll have my staff also put it on the chat as well.
I see. Hafa Chairwoman Perez, honorable senators, thank you for the opportunity to provide testimony on Bill 276-35, an act to amend subsection 3417 of Article 4, Chapter 3, Title 11 of the Guam Code annotated relative to the limiting the hours of the day within which alcoholic beverages may be sold by off-sale licensees. I am pleased to see that this bill that was submitted by Governor Lou Leon Guerrero in January, among other proposed legislation under the Safer Guam initiative, is before us today. Guam Behavioral Health and Wellness Center's vision is that of a healthy island, committed to promoting and improving the behavioral health and well-being of our community. In the last year, we have seen the well-being of our community compromised due to the current COVID public health emergency. This public emergency has had so many negative implications for the mental well-being of our community. This is evidenced by the increase in calls to our Guam Behavioral Health hotline, increased intake for Guam Behavioral Health services, notably in our drug and alcohol program, and increased inpatient care in our crisis stabilization units. It is the responsibility of this department to support legislation that promotes positive mental and behavioral health in our community. And for this reason, fully support Bill 276. As a member of the Lieutenant Governor's School Safety Task Force, Guam Behavioral Health has worked closely with the Department of Education to address underage alcohol drinking and drug use among school-age children. The work of this task force, among with the concerns expressed by our community during the administration's 6 community public safety meetings held in 2019, is clear. Alcohol continues to be a major public safety and behavioral health concern that our community continues to battle. Guam Behavioral Health and Wellness Center's Drug and Alcohol Branch, known as New Beginnings, continues to do our part in addressing alcohol addiction among school-age children to adult years. We work closely with the Lieutenant Governor's office to identify additional beds as part of the administration's bed expansion program through the identification of government-owned assets that is either unused or underutilized that can be quickly transformed to recovery beds to address the growing need of the resources for those struggling with alcohol and drug addiction. Guam Behavioral Health and Wellness Center's FY 2021 budget passed by this legislative body provided for $1.9 million specifically for alcohol and drug recovery programs for adolescents, men and women struggling with addiction. Guam Behavioral Health has recently made available to the public the latest Guam State Epidemiological Profile 2018 This is attached and can also be found on the Guam Behavioral Health Peace Prevention Branch website. Starting on page 48, alcohol, the negative impact on alcohol drinking on our community is clearly stated to include health consequences such as liver disease and cancer, alcohol-related arrests of adults and youth juvenile, which include traffic and DUI, and alcohol-related deaths. In addition to this Guam Behavioral Health resource, I present to you several organizations and their positions supporting the limiting of access to alcohol sales. The World Health Organization, better known as WHO, state commercial and public availability of alcohol can have a reciprocal influence on social availability of alcohol and thus contribute to changing social and cultural norms that promote harmful use of alcohol. I'm sorry, my copy is a bit a bit blurry for some reason. Enacting and enforcing, another point that WHO makes is that enacting and enforcing restrictions on commercial or public availability of alcohol through laws, policies, and programs are important ways to reduce harmful use of alcohol. There are essential measures to prevent easy access to young people and other vulnerable and high-risk groups. Another point by WHO, some of the recommended policy options and interventions include regulating days and hours of retail sales, regulating models of retail sales of alcohol, regulating retail sales in certain places or during special events. And last but not least, by WHO, risk for binge drinking and underage drinking while we are on lockdown could be addressed through policies such as this and public education on the harms of alcohol. Another resource comes from the Task Force on Community Prevention Services, supported and recognized by CDC. And they state, alcohol-related goals and objectives were added and carried on from Healthy People 2010 to Healthy People 2020, the nation's public health agenda, to address the need to reduce the negative effects of alcohol use in the United States. The task force has issued multiple recommendations in line with this. Two of them are maintaining limits on days of sale and maintaining limits. Our recommendations are intended to prevent excessive alcohol consumption and related harm by regulating access to alcohol. The need for more alcohol and drug recovery programs will only continue to grow year after year unless we do several things as a community. Number one, ensure safeguards are in place to encourage responsible drinking by adults. Two, completely eliminate youth access to alcohol. And three, focus more on prevention strategies towards our youth population today so that the number of adults with alcohol addiction will be less in the future, which will reduce the need for government-funded recovery programs. Bill 276 directly addresses points 1 and 2. Thank you for your time and this opportunity to provide support for Bill 276. Sincerely, myself.
Thank you so much, Director Arreola, for your testimony. So yeah, there was a couple, before you joined, there were, my colleagues had several questions that you may shed some light on. I think one of them was sorry, maybe if I can recognize Senator Marsh-Titano, if you want to address questions to Director Arreola, if there are any questions that you want to reiterate.
Yes, and I appreciate the director for coming on, and it's always extremely important to hear from the Guam Behavioral Health and Wellness Center especially, you know, they are at the heart of tackling the many issues that we're dealing with. And what we do want to do are precisely the things that she was mentioning. We want to prevent as much as possible. We want to close off that access because that was never anybody's intention to allow for any access of alcohol to the youth and the like. So earlier, and I apologize if I missed it, I was trying to listen intently, but are there any statistics that we've seen, especially during this pandemic, that there has been an increase in the mental health concerns for our youth and possibly their access, you know, to alcohol through situations like the stores having these many hours that we can sit. I worry a bit with especially being at home and not being in school, and I understand and support the reasons for that. We're not at a place yet, I don't think, where we can go to school, but it does create dynamics with parents and students being at home. So are there any specific informal or formal statistics or reporting back from those within your agency?
Thank you, Senator Marsh-Titano, for that question. As I mentioned in the testimony, in addition to the testimony, I've attached and provided to the chairwoman the 2018 EPI profile. This is the most recent profile that study put together and data put together. And so that's definitely a resource that I think every senator's office should have right nearby. And so again, that can be found on the Guam Behavioral Health Peace Prevention website, but I also provided it to Senator Perez. And so I'm sure she can shoot that out to everyone, so you don't have to search the internet, the website. But compiling of data is the latest official data resource that Guam Behavioral Health has commissioned and has looked and has provided the general public with. I do want to state that because of the many things that island leaders have done in the past, to include the increase of age limit, and for example, that's just one of them, has shown a trend down for alcohol drinking, but it's nowhere close to where it should be. So there is a trend down because of legislation such as increasing the age of drinking, and such as legislation such as this that can assist in ensuring that only responsible adults purchase and consume. And so there is a downward trend in alcohol use for youth, but it's nowhere far. All you need to do is talk to the Department of Education. Senator Perez had mentioned any teacher. Alcohol, we've been working with the Department of Education. I've had conversations with Superintendent John Fernandez. I work very closely with Nadine Cepeda at the Department of Education, who handles, who oversees all their counselors and the behavioral health program at Department of Education. And alcohol drinking is still a big issue. And so you have to wonder, as a community, as adults who are trying to help, how are these kids getting this alcohol? And so, you know, and it's showing in the studies, in the community forum, public forum that the administration had done last year before COVID hit our shores, parents are talking, that kids are accessing, and it's unfortunate because I think mom and pop stores are doing, they're small businesses that want to make a living, and for somehow the children, school-age kids are getting alcohol. Now, I'm not saying that these owners and store clerks are allowing the purchase of alcohol by underage, but clearly it's coming from somewhere. So somebody is purchasing it at the right time in the day so that these kids can are walking in, as Senator Perez said, either drunk in school and they've already consumed it, or carrying it around in their flask when it was allowed. I'm not sure if carrying flasks these days are allowed. Well, pre-COVID, that is, was allowed. But so the trend of, and all the work that Guam Behavioral Health Prevention Branch has done with nonprofit organizations giving sub-grantees from our prevention grants to work with the school-age kids, that has also helped bring down the numbers. But nowhere, absolutely nowhere far to brag about. We have a lot more way to go. We have and it's evident, we have too many kids needing the Guam Behavioral Health recovery programs at Sanctuary, which is Sagan Guman Nahomlo, which is a specific home for a drug and alcohol program that's focused on the youth and adolescent population. Until where there is no need for that home to exist, we have much to do as a community to make sure that that alcohol does not get into the hands of children. And so I just want to thank this legislature for the funding that we received in providing all our nonprofit organization partners who actually run our drug and alcohol program residential homes, because it's much needed. I mean, it's never going to be enough, as I stated in my testimony, until we eliminate the access of alcohol to all children, and until we put safeguards so that only responsible drinking occurs by adults. There's going to be always a need for recovery programs on our island. And I think our goal is, of course, we don't want it at all to exist, but if we can really reduce it so that the number of beds is very few, then I think we're doing good for our community. But we're far from that right now.
Sedus Masi for that answer. And I really appreciate that, you as director, when I'm assuming it was tied in with when that study came out, there was that article, I think it was last week, that made it clear to the community these issues at hand, and that there was a resource that could be looked at. And I did download it and skim through it, and from my recollections, it said things like our tobacco use and our alcohol use are higher than national averages. And so, yeah, that's something for us to consider. And I agree with you that each of us policymakers should have that, on top of our desk almost like all the time, because while we have many things that we're facing, these high rates of suicide and these high rates of, these uses, and then the issues that are tied with them, there's something we have to solve. Like, other parts of us are important, but the soul of us and our youth, yeah, they're everything. And if we're not protecting our youth and stopping these suicides, then a lot of the other things pale. But and the other part I really liked or I think that was important to hear, was that legislation makes a difference. And so as we considered this, it's important for us to hear that, because we may think, you know, and I don't know everybody's full assessment about what the difference of some hours of business mean, but to know that we have that possibility in our hands to make a real difference through legislation. So those were the two main points I wanted to make. And, you know, as I said before, I want to continue hearing the testimony and the perspectives, because making a difference is really what it's all about and what we're here for.
Right.
So
thank you, Senator. And as I mentioned, the IPI profile report was just released and is available for everyone and for every single resident of Guam, parents, all of you lawmakers, policy makers, community leaders. The data should determine, you know, data drives decisions, sound decision. And it is very clear that the data here today is that there is still room for legislation that can help in this regard, but still allow for the liberty and businesses to happen. All that's going to happen is that stores are still going to be allowed to spend, to make money. They're just going to have to sell it at a reasonable time. And so I personally don't see Bill 276 as a hindrance to the small business at all. To say it's a hindrance to small business flourishing is to say that 276 eliminates the sale of alcohol completely and Guam is completely a dry island. And we're not. We're just trying to limit it in a time frame that's more reasonable. So thank you. Thank you.
Yeah, and I can attest it was real easy to find it and it was real easy to download. So yeah, I do encourage as many people as possible to download it and take a hard look at it. So just Masi, Madam Chair, for letting me ask some further questions.
All right, thank you, Senator Marsh-Titano. So we do have Ray Lanetta on here in the waiting on the room. I don't know if you wanted to present testimony, Mr. Lanetta. Is there anybody else that would like to present testimony? Okay, so yeah, so thank you, Director Arreola, for your presentation. And yes, oh, there we have Mr. Lanetta. Good morning, Mr. Lanetta. Sorry, you're on mute. So if you can unmute yourself. You're still on mute. Is there a way to unmute him? Yeah, we can't hear you. If you can unmute, there you go. Oh wait, you just muted yourself again. Yeah, okay, you're good. Can you hear us? Can you say something? Yeah, you still.
Okay,
Oh, okay, great. All right,
okay.
so
Sorry.
kind of testimony.
So I'm on the road. I'm speaking as a member of the Alcoholic Beverage Control Board. I'm not speaking as the chairman. We've had as a board discussed the times, but we have not come to a vote on yay or nay. It's, you know, I'm kind of like in between this, but I'm leaning towards that status quo. I don't think we need to change the times. And in looking at what is proposed, it's kind of confusing. You know, you've got weekends, holidays, then holidays determined by the governor. I think we're trying to address a problem that is more of kids drinking alcohol, and not necessarily the big picture of the community. I just feel that the status quo is okay. I don't think a change needs to occur. And again, I'd like to reiterate that I'm speaking as a member of the ABC board and not as the chairman. Because when I speak as the chairman, that means all of the members basically are in consensus of how I'm speaking. Okay, so for me, I don't think a change is necessary. I think status quo is okay. I think we're trying to address a problem that should be resolved through enforcement, finding the parents or finding the people who are allowing these children to access alcohol. I think that we should do it the way we do COVID, where we do contact tracing from the point where a child gets alcohol all the way up to the chain of how that child was able to access alcohol through the parents maybe, or through a salesperson in a grocery store that sold a minor alcohol. But you know, my personal belief is that we implemented alcohol server training going on about 3 years now. And I think that seemed to be working. There's more emphasis in making sure that the people who dispense alcohol are properly trained. And I believe they would be afraid, should it go back to them, that they gave a person not authorized to get alcohol. I think that that's a good prevention measure. And I think that maybe what we should focus in are punitive measures to ensure that the people who get alcohol, you know, without the proper age, or how am I saying this? I think the punishment should be the more of the focus and not necessarily the time frame.
Okay. All right. Thank you, Mr. Lanetta, for your testimony. So I would like to, before we ask questions, further questions, thank you to my colleagues for your patience. We do have another member of the public that I believe is willing or is here to provide testimony. Good morning, Belinda. Do you want to provide testimony for Bill 276? Sorry, yeah, can you hear us okay? No, you can't hear. Okay, so you're experiencing, I would suggest maybe restarting your computer. That seems to do the trick a lot of times. And, or maybe it's the sound. But there's other opportunities if you are unable to get that fixed. If you want to email us your testimony, if it's written, and we can then share that with my colleagues and the public as well. Okay, so while Belinda is restarting her computer, Belinda, can you hear us okay? No. So you're unmuted at this time. If you want, can you speak? Yeah, we still can't hear you. Yeah, there's no sound coming through at this time. Yeah, perhaps my office can reach out to you to help you with yeah, but you are welcome to provide written testimony as well. I'll have my office reach out to you to help kind of troubleshoot. Okay, so we're going to move on with the questions from my colleagues. Senator Therese Terlahi, do you have any questions with those that testified? ABC Board and Guam Behavioral Health.
I'm just checking. So, Director Arreola, when I looked through that epidemiological report, I don't see anything specific to, setting time limits is going to impact underage drinking. However, I remember vaguely, and maybe I'm going to try to look it up, but when we set that 2 a.m. deadline for drinks in on premises, that I do, I think I recall that GPD has statistics that DWI had definitely decreased. So I check on that. But as to underage drinking, I had asked earlier, if we have anything that we can point to that correlates. So I know that you said decreasing access to minors in general. Of course, that's what we want to do. But I guess the theory is that by decreasing access to everyone, we would in turn be decreasing access to minors overall.
Because I mean, the realities are assuming that, minors can't buy it, so they're getting it from somewhere.
Okay.
So, and you're correct, Senator Terlahi, the EPI report does show data of DUI it starts on page 48 of the report, and there's a lot of data that's interlinked with GPD stats. So if you go further down, not 48, but further down in that section, okay. You're going to see stats that reference juvenile arrests and on DUI drinking. And so that's a bit of the data that you might want to reference, or you're probably looking for.
Yeah, so I looked at it quickly, and it shows very direct correlations between policies that the legislature has adopted for, like you said, increasing the age, and then they show statistics that show it definitely decreased, alcohol and drug use or tobacco use among, different age groups, and then and then increasing the taxes was another policy that was passed, and that had impacts on decreasing.
Definitely.
Yeah, I know we have data that shows 2 a.m. limit on premise and off premise, decreased DWIs, but I just want to know if we have anything more detailed. But I agree also.
Probably, I mean, the data I have is with the EPI report, but there's probably more detailed data. I think that you're trying to get into really the details is probably data that the Guam Police Department will have.
All right. Okay, we'll check.
Because I'm sure that they can break it down to what time are these arrests and the ages of those arrests.
Yes, that would be helpful. Thank you. Yeah. Mr. Lanetta, Thank you. Mr. Lanetta, thank you for your testimony. Is there a task force that the ABC has that investigates sales to minors? Is that been reported to be the issue that there are direct sales by mom and pop stores to minors? Is that on the increase, or do we have anything that shows what's going on there? Or all right, okay.
Okay, I'm back. I'm sorry. There has been a task force as recently as pre-COVID that I'm aware of that have gone out there between GPD and the ABC board. I don't have the statistics on what they're seeing, but if we're focusing on underage drinking, I don't recall that being a problem. It's the problem with the task force basically is mainly establishments that may be operating past the time that they're allowed to remain open. But if we're focused on underage drinking, that really is it's like near zero. It hasn't come up, if I recall correctly. I just feel that we're trying to solve a problem that may be, we're trying to curtail the supply, right, by preventing the establishments to sell alcohol. And I think the root of the problem really is access to the alcohol. and measures that we should put in place to punish those that give access to the kids, right? And finding out, through contact tracing or whatever, going all the way to the root of the problem of where they're getting the alcohol, and punish them. And if it continues on, then then increase the fines and the punishment, and have them increase jail time or whatever. But I think adjusting the time, just the problem will still be there. That's how I believe. If they want to access alcohol, they'll access alcohol some way or another. And so what you're curtailing is the people that would be drinking responsibly. And that would probably be the majority that you're impacting, and not the small amount of folks that are getting alcohol illegally.
All right, thank you. Thank you very much, Madam Chair.
All right, thank you, Senator Terlahi. Is Belinda, she available at this time? Okay, maybe not. All right, so we'll move on to my other colleagues. Senator James Moylan, do you have any questions?
Thank you, Madam Chair. Thank you, directors. So in this bill, we're basically moving the sale of alcohol time from 9 a.m. to 2 p.m. So we are no sale of alcohol from starting at 12 a.m. to that time. That's 15 hours, depending on when the store opens or closes. But that's 5 additional hours that we're looking at. And if I'm understanding our purpose for this bill, because there's no intent mentioned, but I'm understanding it with this public hearing, is to prevent underage drinking, which is already illegal. And I can see where we want to do some measures that way to help prevent it, but I'm trying to really grasp it where this can really make a big difference, rather than just slowing the sale of alcohol for responsible people. Like ABC board was, Mr. Lanetta was saying, they're still going to have, they're doing it illegally now. They're still going to be able to do it illegally. It's like getting into a bar with a fake ID. They still sneak on in. So I'll have to do some more research on that, but I appreciate Director Therese on you explaining that this is a problem for our youth. I just don't see this necessarily as the right solution. And kind of going with what Mr. Lanetta was saying, that it's more about the enforcement part and us being able to provide more enforcement for DRT, for their investigation, and also more for ABC to go out there and inspect. If the establishments know that they are really being watched and watched really hard, they don't want to lose their license or be penalized or fined, I think they would really put the hammer down. But just by increasing the times of when people can actually purchase the alcohol, I'll have to read it more into this. But I do thank you for your testimonies. Thank you, Madam Chair.
All right, thank you, Senator Moylan. Senator Taitigui. Thank you for your patience. And your hand up.
No worries. Thank you, Madam Chair, for the opportunity to speak. And thank you for everyone who's here today testifying on this. I do know there is issues in the schools for drinking alcoholic, the young adults, obtaining alcohol, taking it to school and drinking it and carrying it in their backpacks and hiding it and thinking it's fun or what. But I know there's an issue. But I think that, I think Senator Moylan hit it on the head when he said that, we're restricting those who are responsible drinkers, people who are responsible in obtaining, following the law. I think if we look at statistics, and I've been trying to look at some statistics because I was told, and I'll get more of that information, that even though we've taken the time frame from 4 a.m. on weekends and holidays to 2 p.m., there hasn't really been that much of a difference in change of, DUIs or arrests during that time. So I'm looking forward to getting more information and data directly from the police department to address that. But I think if we want to see statistics change and we want to see a difference, I think it all comes in with enforcement. And like, Ray was saying earlier, contact tracing, it's basically investigating and finding out where these individuals are getting the alcohol. Nowadays, you're finding more stores, mom and pop stores especially, they have video cameras up and they do it for their protection. This is one sure way to obtain, when we do the investigation, is finding out, being able to pull their videotape and researching it to see if there's any young kids coming in that are purchasing alcohol, especially if the owner is not there and those that are behind the cashier. Because we know that's probably where the problem is. It's not really the owner of the store, but sometimes it's their employees, who will do this. But I don't think that we can continue to restrict those who are responsible in our community, by bills like this. I think it's shooting from the hip. And if we really want to make a difference, it's enforcement. That's the way we need to go on this. But thank you, Madam Chair. Again, thank you everyone for testifying today and being here. Thank you, Madam Chair.
All right, thank you, Senator Taitigui. Senator Mary Torres, you have any questions?
Thank you. Very, very interesting discussion. And I don't want to repeat some of the sentiments that were already expressed. I do want to say to Therese Ariola, though, that I certainly want to do what we can to help you in your efforts to curb the alcohol abuse in our youngsters. I know that it's been a big problem and probably growing, but what we really need to focus on is, in terms of access to alcohol, is the black market alcohol that is so readily available out there in our community, mainly because it is affordable. And we know that one of the deterrents for alcohol and tobacco has always been price, right? Whenever there was an increase in pricing, there was a corresponding decrease in the sales. And right now we have, and it's been discussed over and over, especially when that tobacco tax bill was presented, how there's so many products, black market products, being sold in the community, products that are either consolidated in containers and not declared, products that are so underpriced because the people bring them in and do not pay taxes on them. What I'm referring to, for example, is that $4 or $5 bottle of vodka that's sold in the mom and pop stores. The tax on that bottle alone would be prohibitive, would not allow it to be sold at that price if indeed the taxes were paid. So I think that while we're talking about limiting the access to alcohol products, we have to do it in tandem with enforcement. Mr. Lunetta talked about enforcement, and I part of
So you're coming in
also is highly regulated. Okay, I'm sorry. Okay. What we also have to we have to follow up on is where we're trying to discourage the sales or the access to alcoholic products by minors or anyone that abuses it. We also have to ensure that the access is tied into the pricing, because if you're able to sell black market products, black market in that they're not taxed, right? They're underground kind of products. If you're able to sell those products cheaply, those are oftentimes, more often than not, the products that are bought, that are consumed by people who abuse it. Those $5 bottles of very dirty vodka, for example. I think that is the issue more than anything right now, limiting the sales. And there's an argument about whether that'll be effective or not. But I think what is clearly will be effective is if we were to enforce not only the sale of these products to minors, but the sale of only legitimate products on the market, not black market products that are snuck into Guam and bypass taxation and are sold so much cheaper than anything. Because we know with, and I use cigarettes as an example, whenever the prices are raised, there's a corresponding decrease in sales and usage. That statistically has been the statistics over time. So I'll continue to look at that and keep an open mind to this legislation. Thank you.
Madam Chair, if I could just add one thing, I put it on the chat, but just so everybody's aware, Guam Behavioral Health has several funding sources that has helped in the monitoring of illegal sales of tobacco. And so what I have done, and so some of those programs are, we have an FDA contract, and that's completely federally driven. I don't even know when the sting operations happen. I mean, it's driven. We hire a couple of people for that program, but they work directly with the feds, and they have training with adults who look really, really young that go in and do a sting operation in the stores. And so we have two programs, that federally funded FDA contract, and then we have our locally funded SINAR program, which does the same thing. And it's that program that we work hand in hand with the Department of Rev and Tax in. And we have been tasked since last year to work in tandem with each other, with departments like Rev and Tax and GPD, with regards to the SINAR program, linking it to like major consequences that you folks have mentioned that needs to happen with the threat and ramifications of losing their license. But I do want to say that these programs are tobacco focused. And so today we're talking about alcohol. And unfortunately, the federal program is lucrative, but it's tobacco driven. SINAR is, thanks to the legislature, is locally funded, but again, strictly focused on tobacco. And so one of the things that I've talked to the Department of Rev and Tax Director, our Lieutenant Governor, is that why couldn't we expand the SINAR program to include alcohol sting operation and monitoring? And so maybe that's something, food for thought. But again, the programs we have to monitor illegal sales, and I just didn't put it there, is focused on tobacco and not alcohol today.
Yeah. May I also
just wanted to say that. Thank you.
Thank you, Ms. Sariola. That is an issue actually that I've had discussions with our congressman previously about how to explore that, because they're both highly regulated, federally regulated products. And the reason that I brought it up in this conversation with this bill is that they have the same sort of effect, the high regulation and high taxation, as deterrents to abuse, and helping to prevent readily accessible, because it's there for the buying and it's affordable, right? So, and that's why the two can be looked at as comparisons and policy, that where it applies to one product, it also applies to the other. But let's certainly look at that, because I don't see why it shouldn't be. If it's so highly federally regulated, it could easily dovetail into the other products, I would think.
And
Thank
so until we work something out with the federal government that recognizes that the FDA funding can be used to monitor illegal alcohol sales, I think the onus is on the local funding. And so we're trying to do that given the budget we have. Because in the local SINAR program, there is no limitation. We can expand it. I mean, I asked a simple question: why aren't we doing this for alcohol? And they're like, yeah, why aren't we? And I think it's because the local program initially was mirroring the federal program, but that's one thing. And I get it. The federal program gives you these guidelines and you do it until they tell you can expand. But locally, I think we have more leeway and allowances if the will is there and the support and the resources there as well. So thank you very much, Senator Camacho, for that.
Right. Thank you, Senator Camacho. Yeah, so I think, when we're talking about access to drugs, so I think, when we're talking about trying to curtail, youth use of drugs, I think it's a demand and supply issue, right? You want to address the mental health conditions, as Deputy Director Michelle Santis was saying, is that the reason why the student was able to access alcohol is because he received it from his family member. And I see that's not an infrequent circumstance here on Guam. And, that kind of ties into what Mr. Lanetta was saying, is the idea of treating it as like contact tracing. So, with Guam Behavioral Health, and their treatment programs, I know it's limited, as far as resources goes, but, are there programs available perhaps that can be federally funded to kind of address the addiction within the families and preventing addiction from taking hold in the younger generation? I think that's something that I think is really one way to address it, is the need, right? You want to curtail the need or the demand for the alcohol. And I think that's where Guam Behavioral Health can provide some assistance in addressing it. Are you?
Well, we have the Senator, the federal funding we receive is the block grant. We have the substance abuse prevention block grant. So we have two types of block grant, all funded by SAMHSA. And we do what we can, because that block grant funds quite a bit of our prevention program. But even with all that, we're still seeing an issue with underage drinking. And as you mentioned, if enforcement and a type of contract tracing model, if you will, is the way to go, and I think the ABC gentleman mentioned, it's about somebody is buying it. Well, exactly. I mean, assuming I want to give credit to businesses, and I am going to assume that every business does not want to lose their liquor license. So who is buying the liquor for these young folks to begin at such a young age that they end up being adult binge drinkers that impact the government resources in the need of adult recovery programs? And it's the adults. It's unfortunate, but it's the adults. So if you want to curtail that, you need to limit the possibility of abuse from adults buying alcohol. Again, I am a very strong believer in the small business community and their efforts. And by no means, I personally, and that's a personal opinion, don't see this as a hindrance for responsible adults to buy alcohol. If I'm a responsible adult and I know I'm going to have a party tomorrow, I will plan my buying accordingly and not be impulsive buying last minute for my family dinner or whatever, if I need a bottle of wine. And so, responsible buying by responsible adults is not the intent, is not intended, this legislation is not intended to take away from. And so somebody, and it's the adults, is buying the liquor for the kids. So it seems like we need to curtail the adults. And not all adults, but just adults that shouldn't be doing what they're doing and buying liquor for kids. But in no way, I want responsible adults to not purchase their spirits and beverages for responsible entertainment. So,
Okay.
thank you.
Well, thank you, Director. I believe, is Belinda still available? Is her audio working? Are you there, Belinda? One last try.
Can you hear me?
Yes, I can hear you. Now we need
Finally.
your video. Can you turn on your video too as well?
Yes.
Okay, great. All right, so yes, if you're recognized, you have the floor if you'd like to provide testimony at this time. And just please restate your name for the record.
Yes, my name's Belinda Snyder. I'm here to testify, although I wasn't able to get the whole content of everybody's testimony earlier because I had audio issues and getting on to the public hearing. So I apologize. But I would like to address some concerns I have. Even though an adult purchases the alcohol in the store, and let's say they take it home and they allow their niece or nephew or family members to consume the alcohol and they're underage, I believe that this is what I would like to see enforced. The parents should be fined or liable and responsible for any other incidences or accidents that might occur. I'm going to give an example. This happened in the early 2000s or late 90s. My nephew, Michael, he was at a family party in Jonya. And what had happened is the young kids, I guess they were drinking, but their parents didn't know. And they got in the vehicle and they were trying to get Michael to go with them. But Michael, I'm glad he has a good head on his shoulder. He says, no, I don't want to go. I don't want to go with you guys. Well, right when that boy left and the vehicle, he got an accident and he died. If my nephew was in that vehicle, he would have been dead. Why? Because he ran into the telephone pole. They swerved, he hit the telephone pole, and then another car was involved. So these are all negligence, excuse my speech, because I had a mild stroke. These are all negligence of the parents or the guardians, whoever's overseeing the party. As adults, you do not have beer and whatnot around children. Even if they're 18, I still call them children. To me, they're not adults until they're 21. And then this drinking age, I don't know if it's still 18 or has it been bumped up to 21. I think that should be considered to the age, and also the parents being fined, or not fined, but responsible for allowing your kids to leave the premises or leave your home intoxicated, even though they don't show it, right? They might be sneaking it without the parents knowing, But the point is, you're having the party at your house. You're responsible for those people's lives. And it's just like people coming into the store purchasing alcohol. We don't know if that person that enters the store is really a child or an adult. Now these days, the kids look much older. So they really need to show their ID, because in PD, I'm not going to name the store because, you know, I don't have any evidence to show you or to put with my testimony. But anyways, an incident happened in PD. A young Micronesian boy, and I know he's not of age, purchased the alcohol. They talk their language. He purchased the alcohol, and I just looked and I questioned the lady behind the counter. Why didn't you ask for the ID, his ID? Because that's very important. Then another issue I would like to bring up is students going to, somebody just text something. But anyways, I'm sorry, I get distracted. Someone just text something on my phone from your meeting. Anyways, students that come to school intoxicated, the parents and the teachers and the administrators of the school, assistant administrators and the counselors, they need to do something about it, because there are children that are coming to school either intoxicated or high on marijuana or high on ice, and it's happening in the high schools. You know that as a former teacher. I know that as a counselor, and I know that as a former teacher as well. So my concern is the kids' safety, the children's safety in and out of the schools. They need to be well educated in the school grounds as well. And they need to check them when they come in to the schools. I am not saying we have to I guess this is what I'm gonna bring up as an idea. When they enter the gate, right, to get down from the bus, somebody should be there or something should be there to indicate, just like when they used to search their bags for guns. Remember when we had shooting at the schools or whatever going on, rioting? They'll check their bags. Then they had to use the see-through bags, you know, the backpacks where they put their books in and their supplies. Well, I think they should do the same throughout the school year. Keep it with their see-through backpack and supplies. And those students that are causing fights, that are rioting, that are causing misconduct in the schools, some of those students, I'm going to be honest with you, they're under either the influence of alcohol or drugs. I've seen it. I experienced firsthand. And so those are the things I just want to bring to the table. Again, I apologize. I have problems with getting on the session. I apologize. And I did not hear everybody's testimony, so I don't know what was already said. So if I repeated anybody's testimony, I apologize. Do you have any questions for me? That will end my testimony, oral testimony.
Yeah, there's no need to apologize, Belinda. You did a great job, and yeah, very important points that the public needs to hear. And I agree that we need to continue this discussion. I think perhaps on the Guam, we have new members in the Guam Education Board, and then this perhaps needs to be prioritized, you know, with underage consumption of drugs and alcohol.
Yes, as we know that the Department of Youth Affairs, that housing area where they keep the youth, you know, it's overpopulated if anybody goes through there. And I feel sorry for those kids, because to me, it's not really the kids' fault. I blame the parents. And the reason why I blame the parents, because when the kids come into this world, they're coming in as a clean slate. They are taught these bad habits. They see it around their family, they pick it up, or friends, or peer pressure. So these are things that we need to look into. And also behavioral health. I know they have AAA counseling there. They have other counseling, but they need to get involved too within the schools. And they really need to educate the kids more what to do, because some kids, they're scared to come forth because of bullying. And that's what I was told as a counselor, school counselor. Miss, I'm so glad you're coming in at 5 in the morning, 6 in the morning, because I said, why, what are you here for? And they would tell me, I'm ashamed to come to the counselors because my friends, they'll make fun of me. So that's why I used to go in early so the kids can talk to me. And some of them do have problems at home, a lot of problems at home, from alcohol to drugs, you name it. And they'll tell you all about it, and then that's when we have to do our part, right? But yes, I'm really worried where the island is headed to, especially when they legalize that recreational marijuana. They just put a cherry on top of the cake, because you have drug addiction going on, which it was very high on Guam, ice. And then you have the alcohol. Now you have marijuana to deal with. And I was really hoping that it wouldn't have passed, that recreational marijuana. It's so sad that a few elected leaders in the past approved that. And so did our governor, Lulian Guerrero. No matter how many times I protest, no matter how many times I went to the governor's office, they approved it. So it hinders the whole community as a whole, especially when it's recreational. Okay, Senator, that ends my.
Okay, well, thank you. Thank you so much, Ms. Snyder. I appreciate you.
Thank you.
Hearing
Be
through the
safe.
Yeah, likewise, be safe. So
Okay.
at this, take care. At this time,
All
I would like to recognize Deputy Director Michelle Santis if she has any closing statements. This is something we afford to all those that introduce bills.
Sorry. No, I have no closing statements. Thank you.
All right, thank you so much. Thank you for those that came here to testify in relation to Bill 276-35. So we are, if you're free to leave this the hearing if you are just here to testify on behalf of 276-35. At this time, we're going to continue on with the agenda. On to Bill number 386-35, COR. It's sponsored by myself and co-sponsored by Senator Therese M. Terlahi. It's an act to amend section 19102C and H, 19104M of Article 1, section 19202A3 of Article 2, section 19403A1 of Article 4, and to add a new section 19203 to Article 2, all of Chapter 19, Title 10 Guam Code annotated relative to clarifying emergency health powers and connecting it to procurement law. So we did receive testimony, but before we begin, I would like to provide an opening statement in regards to the bill. So this bill, because Bill 386-35 was sponsored by myself, Senator Sabina Flores Perez, and co-sponsored by Senator Therese Terlahi. Was created to address gaps within the Emergency Health Powers Act pertaining to local procurement law that were highlighted during the May 21st oversight hearing of the initial procurement of quarantine facilities. By closing these gaps, Bill 386-35 aims to restore public confidence in the government procurement process during a public health emergency by ensuring a fair, open process for government contracting. Fairness and openness helps to foster greater competition and therefore better value in the use of limited government funds. And proper procurement is a key component to rebuilding our economy because fair and equal access to government-funded projects can help keep businesses afloat during this economically challenging time. Bill 386-35 clarifies that all purchases made under the emergency powers must go through established procurement processes. By having emergency purchases conducted within the scope allowed by procurement law, the bill closes loopholes of purchases being made without proper safeguards. The procurement law is intended to protect the people's money and ensure the government is following the law. Bill 386-35 aims to create a task force that must be ready to respond in the midst of an emergency, such as a pandemic, and also prepare for future emergencies. This task force, which includes the Chief Procurement Officer, will be responsible for all procurement, management, and staffing of the procurement for supplies, services needed to address a public health emergency. The bill requires that properly trained procurement personnel be involved from the start of an emergency, and this ensures procurement decisions are not made in isolation by one branch, but collectively by a task force. Additionally, this task force can strengthen the emergency health response by ensuring coordination with timely acquisition of resources deemed necessary by the public health authority to achieve any and all duties and tasks that are authorized by the Emergency Health Powers Act. By reinforcing that decisions are scientifically based, Bill 386-35 also aims to address a community need for transparency during this pandemic, when the new norms involve continually adapting and changing in response to increased speed of infection, rise in mortality, availability or lack thereof of resources, and other emerging conditions. Bill 386-35, in concert with Public Law 35-109, preserves flexibility that is needed to address an extended public health emergency due to the current pandemic, because the updated emergency procurement law allows for options for the use of other forms of procurement with the proper justification and attestation. Bill 386-35 also reinforces procurement law in lifting an automatic stay. So the automatic stay of a protested solicitation shall be lifted by written determination by the Director of Department of Public Health if there exists an imminent threat of public health emergency as contemplated with the purposes of the Emergency Health Powers Act. And that the award of solicited contract without delay is necessary to protect the substantial public health interest of the territory. Lifting of the automatic stay does not preclude administrative appeal to the public auditor pursuant to 5 GCA, nor application to the Superior Court. So in effect, what this bill does, it closes the gaps between Emergency Health Powers Act and procurement law. So I would like to then read into the record some testimony provided. So since GSA did respond, and so I guess I would like to share that with my colleagues, so my staff can provide that on the WhatsApp chat, as well as Attorney John Brown also provided some testimony. So that could be also placed in the chat, but I could read that into public record at this time, since in their absence. Okay, so in regards to testimony from Chief Procurement Officer, this is Claudia Kfaji. Okay, so regarding Bill 386-35, to the Honorable Senator Sabina Perez, we are in receipt of your Bill 386-35, an act to amend sections 19102C-H, 19104M of Article 1, 19202A3 of Article 2, 19403A1 of Article 4, and to add a new section 19203 of Article 2, all of Chapter 19, or the Emergency Health Powers. So they have some concerns. So in Section 3 and 4, their concern was in the statement grounded in a thorough scientific understanding of public health threats. The question is, what happens if a public health emergency occurs prior to a thorough and scientific understanding of the disease, like COVID or SARS or Legionnaire's disease? All of these events occurred before a thorough scientific understanding was made. As such, I recommend that phrase be deleted. The second concern they had was in Section 6, you added a new section 19203. While it states that the development of the Public Health Emergency Purchasing Task Force should you not include the statutory, the hospital administrator of GMH. Further, you did not note the hospital has its own procurement authority separate from the General Service Agency. During a public health emergency, would you not think that the hospital would also need to be purchasing needed supplies and equipment? Is there a reason for leaving them out? In Section 6, Section 19203A, you state such persons employed in the government who, in the opinion of the chair, would be of substantial assistance to the task force is the Director of Department of Public Health now able to transfer even temporarily, employees from other agencies to the task force without consent or understanding the employee's director. I'm concerned about the job responsibilities of the current employee's agency department that may also be important during a public health emergency. The other concern they have is in section 6. You attempt to create a public health emergency task force. Does this task force have to meet the requirements of open government law? If there is an emergency, how can they meet outside the public notice requirement? Or are you stating that the governor's emergency declaration would allow for the group to meet? Further, are decisions of the task force supposed to be decided by a quorum? Another concern in section 6 was that with a statement, the chief procurement officer shall be responsible for the procurement management and staffing of procurement. GSA procures the requested items. It does not have staffing capabilities to manage or staff required use. For example, requiring hotels for travelers for quarantine purposes. GSA does not have the staff stationed at the airport to ensure travelers go to which hotels, nor does it have staff at hotels to address any concerns that they may arise. I suggest that management and staffing be deleted. Section 7. Their concern was with section 19403A1. So nothing in this Title 10 caption emergency health powers is intended to imply or express nor to be construed to grant any power or authority to purchase, procure, or expend public funds under any contract except as authorized under Title 5, Chapter 5 of Guam Code Annotated, caption Guam Procurement Law. The Procurement Code does not cover all events that may occur and that may arise to public health emergency, nor does it allow for emergency actions. For example, GSA needs to get at least 3 quotations. What if there's a delay in getting the quotes? Or a vendor wishes to sell to a government a used piece of equipment that is still usable? Our laws do not indicate the method to purchase it. We suggest the following be added. If said authorization is not available under the Procurement Code, then the governor is authorized to use her emergency authority to authorize said purchase. Thank you for the opportunity to comment on the bill. Claudia. So that is the testimony by GSA. The second one, written by Attorney Brown. So I believe it's on the chat. So dear senators, I provide this written testimony in support of the reference bill. It does 2 important things to settle lessons learned up to now in Guam's reaction to COVID-19 pandemic, which is directly killing its residents when not exacerbating existing illnesses or simply overwhelming the healthy. It is also an indirect cause of significant disruption of normal customs and ingrained expectations and habits of the residents generally, and the employees, owners, and managers of the private sector economy and all residents who look to the economy to provide the things and services they depend on. One thing it has done is pit those who govern against those who are governed, those who govern against those governed, both of whom are confronted with entirely new and dangerous conditions. Both sides deal in good faith as they try to respond, but each views the other as obstructing efforts to rein in the virus and remedy its maladies on one hand, and get on with maintaining the social economic ties that bind us through both good and bad times. There has been widely expressed dissatisfaction with what is reasonably seen by many in the public to be overbearing and authoritarian legal requirements and restrictions imposed by the executive, and unsubstantiated acquisitions whimsically obtained as the government was challenged to deal with an onslaught of demands, and the untested scope of the public health powers were put to their first big test of the public health law. It is a reasonable reaction because one of the explicit findings of the legislature in adopting the Health Powers Act was to manage and contain emergency health threats without unduly interfering with civil rights and liberties, as stated in 10 GCA section 191.3G. I've also been a critic of what I consider to be overreaching of the powers bestowed. And one of those overreaches has to do with the subject near to my interest, procurement. I fall on the side of those who believe the governor's emergency powers are more limited than perhaps is appreciated at ad lieu. I interpret the only power given to the governor in the emergency health powers is to suspend laws or regulations. And the law does not extend any power to direct emergency procurement by any clear or express language. Guam laws are replete with various grants of agency procurement authority, and none of it as vague as a language the governor placed her bet on. Close parentheses. I'm also of the opinion that the governor's powers to suspend law and regulations is also expressly limited and bifurcated. Read carefully and in context of the public health law. The governor has no carte blanche to make or change any law or regulation it deems appropriate in a reasonable manner or not. The statutory regulatory subject matter of such power to suspend is relegated to two distinct subjects: to suspend the provisions of one, any regulatory statute, limited to those statutes which prescribe procedures for conducting business, or two, the orders, rules, and regulations of any government of Guam agency. This does not give the governor to suspend, for instance, the Administrative Adjudication Act, because the statute does not prescribe procedures for conducting business. It only in pertinent part prescribes the procedures by which a government agency, having been given authority to promulgate regulations in the first place, adopts such regulations. The Health Powers Act does not authorize the governor to make regulations, but even if the governor has such to promulgate regulations, they must be promulgated in the manner specified in the AAA process. It shall be the duty of every agency which may have been or hereafter may be clothed with or given any power or authority to make, adopt, promulgate, or enforce rules, to do so in accordance with AAA process. And of course, in no case can an executive regulation conflict with any law. So this governor's power to suspend statute or regulations under 10 GCA section 19401A1 is limited, but it is not arbitrary limitation of or on the governor's organic authority. It is a power entirely consistent with and constrained by the limitation placed on a governor's power established by the Organic Act. The governor may have general supervision and control of the government of Guam, but not when doing so is in conflict with applicable law. Organic Act 48 U.S. Code 1422. Rules and regulations properly authorized by law are meant to be drawn and promulgated by the executive branch, with the consideration of the legislature to the extent provided in the AAA process, which has changed from time to time. It is therefore consistent again with the separation of powers in the Organic Act that the governor is given the power to suspend the executive orders, rules, and regulations of any government of Guam agency, but not laws. Even in the case of both statutes and regulations, suspension in either case is limited under the emergency health powers to the extent that strict compliance with the same would prevent, hinder, delay necessary action by the public health authority to respond to the public health emergency. This bill does two things. It maintains the integrity of the response of the health emergencies and the integrity of the procurement system in the face of challenges brought on by the health emergencies, such as Guam, the world has experienced over the many last months. Is integral to maintaining the trust of the people of Guam within their respective. The need to address a quick response to health emergencies is obvious. It is not obvious in advance of such emergencies how that procurement be safeguarded. It only becomes obvious after money is poured out of the fire hoses on the emergency that there should be order and accountability to where the fire hose was pointed. The first purpose of the Emergency Health Powers Act is to require the development of a comprehensive plan to provide for a coordinated, appropriate response in the event of a public health emergency. Two pertinent underlying purposes of the Procurement Act are to provide for increased public confidence in the procedures followed in a public procurement and to provide safeguards for the maintenance of a procurement system of quality and integrity. This bill speaks to the government's need for prompt responses to health emergencies. One legislative finding expressed in the Act is to give the government of Guam the ability to respond rapidly and effectively to potential or actual public health emergencies while enhancing focus on a more collaborative and planned response to health emergencies. This bill establishes a select group of first responders with the formation of a representative body or task force of first responders. They will be the answers to who you're going to call. They are tasked with the critical duty to be alert and kept alert and informed as to the nature, extent, likelihood, and timing of incipient threats and track them, the essence of vigilance. They will be easily identified and gathered together quickly and are leaders of the various departments and divisions of the government who provide hands-on first responses, including the Director of Department of Public Health and Social Services, the Chief Procurement Officer, They will keep the governor in and essential to the loop and have direct access to critical information regarding resources, personnel, supplies, services, financing, and methods of mustering them. Everyone in the loop will be on the same page. Most importantly, they will be already organized, not cobbled together at the last minute, be the core for the planning committee and plan already contemplated in 10 GCA section 19202. By meeting regularly as need is perceived, they will be able to talk ahead of time about who is to do what in the face of an emergency and thereby minimize, if not avoid, who's on first track. By keeping the task force numbers small, it can be more flexible, prompt, and effective. Ensure they should be capable of and kept on top of planning and executing contingencies in advance of the onset of an emergency. One thought would be to unhinge a task force from the open government requirements to give public notice of their meetings, but not from the requirement to keep minutes or other records of the broad thrust of a meeting and make them publicly reasonably soon after the fact. The bill speaks to the need for procurement accountability, which is a necessary component of accountability to federal agencies for their aid, funding, and grants. The procurement law has emergency procurement law and regulations dealing with accountability and process already in place, which offer considerable leeway to acquiring supplies and services needed immediately and for the month after the emergency is declared. And at this point, it's now 3 months since we just passed Public Law 35109. That time limitation is not an end to procurement authority. Are meant to be preparing other solicitations such as RFQs, IFPs, and so on as soon as the emergency begins. Unfortunately, Guam is not very good at planning at most things, emergency or otherwise, but if the populace is to be fined for not wearing masks, for instance, the government should be penalized for not following procurement procedures. Hopefully this COVID pandemic or something of its ilk will not repeat soon. The history of SARS, swine flu, chicken flu, Ebola, and all the rest suggests this can happen again by an endemic disease, if not a pandemic. With this bill, we should be better prepared. With respect to John Thomas Brown. So those are the two that submitted testimony, and I believe we reached out to others. If I can pull up the listing, we did reach out, I believe, to the Department of Public Health, and I believe all those that are involved in the procurement network. I believe Office of Homeland Security or Office of Civil Defense and others. So being that is nobody here to testify, I guess I can open up the floor to my colleagues for any questions at this time. Or comments, questions or comments. Okay, Senator Kelly Marsh Chaitano, you're recognized.
Mrs. Masi, Madam Chair, and yes, I look forward to hearing from others on this as well, those that are affected. There are important points brought up by the testimony, so I'm glad that both pieces of testimony that we've received thus far outline the issues that they see. I do want to point out that for the GSA testimony, I downloaded it, but if it can be provided through email, because it wasn't in a format that I could open, and I'm not sure why, but anyways, because I really do want to read that. It's got a lot of detailed recommendations in it that I think are very important for us to consider. So the 2 points that I just want to bring up, although I want to continue to hear from others, but at this point in time, some of the language, I just wanted to make sure that for the bill to carry out its intended purposes, that the language is there, and maybe it's already there, and maybe it can just be explained to me further at some point, either here today or some other time, but where it has there that I think it's state of emergency, but yeah, that the health powers must be grounded in a thorough scientific understanding of public health threats and disease transmission. And so I just want to make sure that that's something that can stand up to a challenge or just be broadly understood by the community and the agencies, the entire government of Guam. It seems to me with the situation that we're in today that there are very scientific understandings, there's new breaking information all the time. And so again, I just want this to be something that can be legally upheld, but perhaps there was legal guidance in the development of these terms.
Yes, so thank
yeah.
Senator Marsh. Yeah, that language was actually taken from the legislative findings in the Emergency Health Powers Act. So it was just basically there to reinforce that idea. It's nothing new to the Emergency Health Powers Act. And in regards to scientific, it's grounded in scientific knowledge. It's, science is also a moving target. You ask questions, you get new information. So, it applies. It's something that is very flexible and responds to changes and new information. So as you know, the scientific method, you ask your question, you investigate, you come up with data and analysis, and then you come up with a new question. So it's very much it's very similar to what's happening nowadays, where we have a response based on the information that we have, and then later on the information changes and we have to respond accordingly. So it's a moving target. It's not something that is fixed and stationary. Yeah, thank you for that question. But yeah, it just it basically uses the language verbatim that's already in the Emergency Health Powers Act and places it there for emphasis.
Okay, yeah, like I said, I just want to make sure that this is something that can be, if there's a challenge, especially something that can be upheld. So the difference between the way that we converse, formal English, and then what is legally discernible or able to be upheld are different things. So I want to make sure that this is something that meets that criteria. The other is just, it follows right after, and it says guided by principles proportionately affecting the whole of the island community. So perhaps that can be explained, and it's the same thing. I want it to be something that's understood by the community and the government, and something that can be legally upheld. So if we could get some clarification into what is meant by that, principles of proportion, let me get that wording correct again. Principles proportionately affecting the whole of the island community. Perhaps that was something found elsewhere as well already in statute.
Yeah, that's actually that question. And I think this basically goes by some in the community that feel maybe the responses might be disproportionate to addressing the public health emergency. I think it ties into one of the principles of the Emergency Health Powers Act in regarding to protecting civil liberties. And I think that just kind of helps to reinforce that part of the Health Powers Act, is that the response is not only scientifically based, but it's proportional to the need. I think that's the rationale behind that. But as far as the language, yeah, I can go back and check and see if that's something that could be improved too as well. So I appreciate your question, Senator Marsh.
Sidus Masi for that. Yes, like I said, I just want to make sure that the intent is able to go forward in the way that it means to, and it can be something that is discernible to the community and is being able to make a strong case and withstand any legal scrutiny or challenge. So like I said, I look forward to hearing the other perspectives and comments and possible questions. And thank you for allowing me to bring those couple of points up.
Thank you. Thank you, Senator Marsh-Taitano. Senator Taitigui, you're recognized.
Thank you, Madam Chair, and for the opportunity and for introducing this legislation. I mean, the intent of this bill is, is admirable to what we're trying to, accomplish here, and then that is the transparency and the accountability of purchases being made. Also, the definition of public health emergency, to be established, and the task at hand, the task force. To regularly monitor potential public health threats. However, in some of the bill, as I'm looking at it, there are some concerns I have with, and Senator Marsh mentioned it earlier, that, we want to make sure that it passed mustered and there's no anyone having to question its organicity, to be, if it's inorganic in some circumstances in here, like on page 4, there might be a question on that. And of course, a question about the, how do we have a thorough scientific understanding of COVID, so that we can understand. And you actually answered that question. It's science is, it changes all the time, quickly too. How do we enforce alertness? The words that you used, alertness, in here too, is something. So I think there are things that need to be probably, really on a legal perspective, to be reviewed to ensure that the intent of this legislation gets through. But I greatly appreciate the, working on procurement. It's very difficult. Many of us in the legislature really can't understand a lot of it. And I always say that we should just follow the federal guidelines because they're much more simpler and that are put in place. Maybe that's what we should do, is just, follow all procurement guidelines as the federal government does, But anyways, I greatly appreciate what you're doing here. And it does look like we really need to look at some of the verbiage in here to make sure that we're not doing anything that's not in line with the Organic Act of Guam. That's one of my concerns. And of course, alertness, the word alertness. How do we enforce alertness? That's going to be hard. But other than that, again, thank you, Madam Chair, and thank you for taking on, procurement. It's always been an issue. I know the former Senator Ada had tried to do this, and it became very difficult. So don't give up. We'll all be there beside you working on it. Okay, thank you.
Thank you, Senator Taitigui. I appreciate those questions and comments as well. And I think now is a good time to really reflect on the Emergency Health Powers Act and how we can improve upon it. And I think too, we've been in all these meetings and briefings, senators, we've been in briefings with the Physicians Advisory Group, the Surgeon Cell. And, it's perhaps, I don't want to create more bureaucracy, if anything. I don't want to make it difficult to respond. That's the last thing I want to do. But I think if we can strike a balance with, getting the information out there, as far as, what is the, and I know this is difficult to do, right? It's easier to say and difficult to do in regards to, you have to respond to something quickly, but you also have to communicate to the public what you're doing. And I think, that, and also I think coordination is an important thing. We have different groups doing one thing and they're not really on the same page, or maybe they are. At some point they become on the same page. So I'm willing to kind of look at, how can we improve this so that it's going to work for us in a way that it helps to coordinate the response and ensure that, procurement law is so important because, if I can liken it to something really, really totally different, like nature, right? Nature, is able to recycle what it produces. But when we throw synthetic materials in there, then it can't break it down. And similarly, if I can make that sort of connection, I don't know if that's an easy connection to make, but if we follow already the processes in place, it will take care of itself. But if we veer away from the process, once we hit a problem, it's going to be hard to get back. So, I think that's, and with procurement, obviously, purchasing for your own household, purchasing as a business, it's very different from procurement. And as such, that's why, a lot of people complain about procurement, because it's not as fast. It's not as fast as a business can do it, or it's not as fast as you can do it yourself. But the reason why those rules are there, and I think we experienced that, unfortunately, is to ensure that, there's going to be a proper way to carry it out. And, that speed that we did in the first place, the speed of doing things when we veer away from procurement laws, might have unintended consequences that are harder to really come back from. So, I think that the procurement law is there for a reason. And even though it may seem kind of a, not as expedient, it's there to protect the government, protect the public's money, really, ensuring that the money is spent properly. And it also is in the best interest of the government to, and it's part of the principles of procurement, is to assure the public that it's a fair competition, it's an open process. And by doing so, you're going to attract more businesses that are interested in government contracts, which can then lead to better value. So, I mean, it's really about upholding these principles, more than anything, and ensuring that businesses out there have a fair and equal chance. And and we want the businesses to be able to compete and be able to get these contracts in a fair way, and especially now during COVID, where they need that extra revenue to stay afloat. So I'm open to dialogue and conversation on how to make this better. Where we are striking a balance with, making sure that there is a quick response, and that we're also coordinating it in a way that's going to, help the government as well as the businesses out there. So I'm sorry, that should have been a closing statement. But Senator Moylan, do you have any comments or questions?
Thank you, Madam Chair. Yes, thank you for authoring this bill. As we can see, the chapter 19 of Title 10, now that it's implemented and first time after 20 years, and how it's being used, we need some changes to it, especially in transparency and following procurement and the AAA process. So I do probably would want to work closely with you to add a few more things to this as we work through it in committee. But I do agree with you. We need to really, the transparency is important as how we're learning from this experience, and strengthening this law will be helpful. And hopefully we don't have to use it once again, but we need to do some improvements. So thank you for sponsoring the bill. Thank you, Madam Chair.
All right, thank you, Senator Moylan. So I did my closing statement ahead of time, but being that there's no more comments or questions, let me get my thing. I believe we're going to be in recess. I do have an afternoon session for two other bill and rules. So if there are no further testimonies or questions, Committee on Environment, Revenue, and Taxation and Procurement will stand in recess until 2 p.m. Thank you, everybody, for your contributions and your questions. Susan Masi.